health equity is really about every individual having all the possible opportunities to positively impact their health and well-being. And right now we know that that is not an equal opportunity. It could be related to disparities in geography, disparities in race, disparities in gender, disparities in economic stability. So all these things impact, and so it is important that you consider all those factors as you think about addressing health equity.
One of the studies that I'm currently leading and listening to right now is hosting listening sessions for minority women to better understand how their experiences of perceived racism impact their prenatal and obstetric care. And some of the things that I'm kind of discovering now is that in the moment, women aren't really realizing that their experiences are racism until we have those discussions, when they're realizing that their treatment was disparate compared to others. Because as it stands right now, for a lot of minority and historically disadvantaged people, what we're seeing is that the highest rates of maternal mortality are occurring in the postpartum period.
We cannot stop caring for a mom once that baby is born. It is important to remain vigilant to make sure that she is connected not only to her healthcare provider, but also to her community so that she can leverage all of the resources that are available to help her should she encounter concerns. And I think CareSource can and does play a role in making sure through care management that our members are served in that critical time period.
I think things are starting to slowly change. One exciting thing in Georgia is we do have postpartum coverage from Georgia Medicaid for up to 12 months after delivery, which is so exciting, and it really speaks to acknowledgement that this is an important time frame for women. Care managers are there to support that member through whatever circumstance they're going through. So I think one of it is to let them know that they are available, what kinds of services they offer, and it's not just the care manager, it's the entire team from CareSource, whether it's the care manager, life coach, or other resources that we have to offer. It's also connecting them to community resources, as Dr. Wright mentioned, so that they see that they're not alone.
Dr. Sukas mentioned about the members speaking up and telling us what their needs are. I think we really want to help educate and inform members so that they can also speak up when they're in front of their healthcare provider. We know that there are certain populations that for various reasons, including trauma, disadvantaged circumstances, etc., don't feel empowered to advocate for themselves when they get in front of their healthcare provider. They don't always ask questions, so they don't necessarily get the understanding of the condition and the ramifications of that condition.
I think that the onus isn't just on our patients to advocate for themselves, but the onus is on our providers as well to make sure that they're having just open conversations and they're meeting their patients where they are and asking questions that are open-ended and thought-provoking. I think that it's indeed a partnership.
We really want to center healthcare and health discussions around the needs of the member. They really should be driving the conversation. What they need, what they're experiencing, what they're grappling with really needs to be the nature of the conversation. And then they need to be presented options so that they can choose the option that's most appropriate for their circumstance. And housing is probably on the top of the list. So if you don't have safe housing, if you don't have affordable housing, if you're facing eviction and uncertainty in that realm, that certainly can have a very negative relationship with you and your body. So that toxic stress can affect pregnancy and can have long-term effects on the child. In addition, if you are overcome with concerns about where you lay your head at night, you really can't focus on the other positive health lifestyle things that we might want to advocate. We need to recognize that different people come from different circumstances, have different historical perspectives, have different barriers and limitations. And I think that we as a managed care entity and we as a community need to put resources in place to help level the playing field.